Hello, people, and welcome to another episode of FemaleFriYay, where you can't be where you can't see. Today, we're going over to Belgium, which apparently is the home of the best beer ever, and we have with us the delightful Dr. Barbara Versyck. How are you doing, Barbara?
I'm good.
You're
Thank you. How are
good.
you?
Oh, we're all good. We're all good at this girl block. So quite busy at the moment, but we're coping. So we're going to start with a relatively easy question. Um, Barbara, your name, where do you come from originally, and where are you currently working?
All right. So my name is Barbara Versyck, and I'm originally from Bruges, and I'm currently working in as a turnout, which is in the Antwerp region. And I'm also affiliated to the Catharina Hospital in Eindhoven for research.
Okay, research, that sounds fun. And what attracted you to regional anesthesia?
Well, I think just like everybody else, I just don't like pain, and I made it. I made it my job, and I think what I like to do is to provide as much pain relief as possible with as little of side effects as possible. And in my opinion, regional anesthesia provides that for a very large patient population.
Perfect. And if you weren't a regional anaesthetist, what do you think you would be doing with your life?
I would probably open a flower shop.
Oh, love it. That's as far away from regional as you can get. So, what's your favourite part of your job?
My favorite part is both the interaction with the patients and the technical skills that are involved with it.
Okay. And since you're an avid regional anaesthetist, what's your favourite block?
Actually, a very classic. It's the axillary block.
Oh,
It
wow.
provides very good analgesia. It can be used for anesthesia. It requires a little bit more of a technical skill, as there are more nerves to be blocked than just one needle puncture. And I just like to perform it.
You're the first team axillary, actually, but I can kind of see why you like it. It's quite sexy, isn't it, the axillary block? So what we're going to do now, Barbara, is we're going to go completely away from regional anesthesia, and we're going to have a 1 minute block break where I have my timer, and we're going to ask you questions completely unrelated to regional anesthesia. Are you ready?
I hope so.
Right, let's go. So Barbara, tell me, what is your favorite pizza topping?
Cheese.
Just cheese. Are you spring, summer, autumn, or winter?
Oof, spring probably.
If you could be great at any Olympic sport, which one would it be?
Gymnastics.
Are you messy or tidy?
Well, according to me or my husband, but somewhere in between.
Okay, are you a takeout or a dine out kind of girl?
Dine out.
And would it be the book or the movie of the book that you would preferably watch?
First the book, then the movie.
Okay, a bit of an out there question. Which Disney princess do you think you're most like?
Oof. I have no idea.
Okay,
Um,
okay.
no
So
idea.
because you had no idea, I'll give you another one.
Okay.
What's your desert island item?
A satellite phone.
Okay, that's a good one because then you could call for help, couldn't you?
Yes.
That's a very practical one. And that would be me just on my own with my iPod, never getting rescued, and like have a ball called Wilson, but never mind. Tell us a little bit about your career path. How did you get to where you are today?
Well, actually, it's a three-way path, so to say. I got into medicine. I was partly inspired because I had a female pediatrician, and she's like 80-ish now. She's still sharp as a pencil. She still reads all the medical research, and she still discusses with me topics that I didn't even would have known about without her. So she was the only female student of her year. And so just for a reference, there are only 2 universities in Flanders where you can study medicine, and she was in one of them, and she was the only one. And she's just amazing. And she learned me, well, that you can not only be a nurse and also be a doctor. Because then, well, I consider myself not that old, but still, at that time, there were more male than female doctors. And I got into medicine. And then I got into regional anesthesia. And actually, that's, again, someone who inspired me. And it was like Patrick van Houwen. And I was a second-year resident. And he is like the person that gives opportunities to everybody that comes along, if you're just willing to take them. And I came back from the Nizora conference, and he was like, okay, what did you learn? How can we implement this in our clinical practice? And really, like, we were talking about regional anesthesia for breast surgery, and there wasn't that much research at the time. And he was like encouraging me to do the research and help me do it. And that was he opened this whole world of regional anesthesia for me. And that was amazing.
What kind of research have you been involved in?
I've been involved in research mainly of thoracic wall blocks, and initially for breast cancer surgery. Yes.
Okay, yeah, I've seen your posters. They look phenomenal. So if anyone wants a poster, they can order one off Barbara. What has been your biggest career achievement, do you think, to date?
It was very early on, actually. I was an intern, and we were in this massive transfusion protocol. And it was so massive that we were just throwing the bags in the corner of the room, and we would scan them later because there was just no time. And I was, of course, not the main character in this situation, but it really made me feel like I could make a difference, like life or death difference. And that really that hung with me. It was something I won't forget. And the patient made it. And that was the first time that really we're making a difference here, and this patient will survive. That was amazing.
And you are a multi-published author, are you not, Barbara, as well? I see some of your papers floating around.
Yes.
So that's a pretty big achievement, especially for a woman in regional anesthesia. I think you're being very humble here.
Well, that again, I was very lucky in that I met like the right people in the right time. Because, as I said, I was doing like research on a beginner's stage, I will say, as a second-year resident. And I went to the ESRA. There was a workshop on thoracic wall blocks, and I went there, and the instructor was Geert-Jan van Geffen, and he was really surprised that back then a second-year resident would know about these blocks, and even more that she was doing research. And he was so kind, and he really took me under his wings and elevated me in this whole research area. And then indeed I had publications in anesthesia and in other journals, and he showed me the way.
Love it, love it. And all of this positivity aside, what do you think's been your biggest career struggle? Or maybe you've just had an amazing career that you're better than us.
No, there are no ups in life without downs. But I don't really have like one big struggle that I can point out that really made a difference in the whole road. Just like everybody else, sometimes the road went up and sometimes the road went down. And in the end, as long as in the end result, you're higher up than you were in the beginning, then everything's fine.
You're making progress. So what's the best piece of career advice, or indeed life advice, that you think you've ever been given?
Well, it comes from Geert-Jan, and he said that if you want to take good care of your patients, you should take good care of yourself.
That's actually a really good piece of advice. And you've already mentioned one, any other strong female, perhaps RA mentors in your path?
I met really a lot of lovely people, and the further along you get in this journey, the more people you meet and the more people inspire you. And it's really the people that have put me on my path as I am today are really the three people that I mentioned before. It's the pediatrician that I had as a child. It's Patrick Van O, who opened this world of regional anesthesia. And then it's Geert-Jan who helped me in the whole research area. And then the further along you get, the more people you meet, and it only gets more interesting.
Yeah, indeed. So what
There are
advice?
too many names now to call, but there are a lot of lovely people that
There
help each other
are.
along the way.
We're very lucky to have such a welcoming and supportive regional anesthesia community. So, what advice might you give women coming up behind you?
I think if you're presented with an opportunity, then you should always be grateful and to the person who is giving it to you. And if it seems like a fun opportunity and you have the time to do it and go for it. And if it's not your time at that moment, or you cannot give your time at that moment for that project, just say it. Because in the beginning, I was afraid to say no. And then, or I was doing a sloppy job, or I was just neglecting my personal life. And in the end, nobody was getting a better outcome. And the people who are giving you those opportunities, they have been in the same situation and they will understand. And once you're far enough in this road and you're in the possibility to give back, you should give back. And you could do it to the person who gave it to you in the first place, or you could do it to someone else. I remember on my own PhD defense, the mentor of my mentor was there. And he was just so proud and so happy to be there. And just to see like the next generation, I think it's a bit like a proud grandparent, not only proud of the children, but of the grandchildren, sometimes even more. And it was a very nice feeling, this continuity. It was really nice.
Perfect. And just to round up, Barbara, will you tell us something about yourself that we may not know?
Well, actually, I'm quite an arts and crafts girl. So every Tuesday night, you will find me in a little shed in the woods with a wood stove with people who are mostly twice my age. And we paint. And
Ah,
there is no electronics, no distraction. It's just 2 hours of painting in this little shed with this warm stove. And it's just the most relaxing thing ever.
it sounds absolutely idyllic, like a painting shed in the woods.
It
It's a
is.
pity it's so far away. I'd love to join you. Now,
If you're
Barbara,
here in the country one day, I'll show you.
yes, well, hopefully I'll be in
I
Belgium
will.
soon and I'll have to come for a visit and a cup of tea. Barbara, you have been absolutely phenomenal. Thank you very much for joining us,
It's a pleasure.
and I will speak to you soon.
I hope so.